Good evening, everyone. Today is Thursday, 4 p.m. I'm going to start off by saying, read your emails. I put a positive quote for today on Thursday, some positive affirmations, things like when you feel that it's rough and, I'm not getting my beautiful assignments. That's just one question and people don't want to respond. I'm upset. I'm like, one question, 5 minutes. And then on the questions that I'm like, we went over the other day, we did it on Zoom. So you already have the answer. And then I still got the wrong answers. So read your emails, read your PowerPoint slides, read your chapter. Medical billing and coding is reading, reading, reading. You're not going to get through it if you don't read. So when you get into this actual SIM chart, you're going to be reading all these patient histories. You're going to be reading everything. And if you're not reading accurately, you're going to have everything wrong because in the system, it checks your answers, not me. So making sure with that. And then also, just to recap, remember for this module, we're really not going to go into the actual SIM chart. I want you to get the basics and everything until the next module. We've been discussing that with the instructors as a whole. Because it's so much information you have to understand. And then last year, I know Misty can attest to that, it was serious with going into that SIM chart. But you have to have a computer, not an iPad, not your phone. It will not work at all. You're actually in a clinic. So you will not be able to use anything other than an actual computer, desktop, laptop. It will not access through your phone or an iPad. So just make sure that you're aware of that. Several of the modules we'll be going through, you have to have a computer. So, look, we have all of these sales. And also I know I have some, they have some resources that I guess I will post for you all. If you do not have a computer, they have some resources that I know Unitech will provide as for different plans that you can go through to get a laptop if you're not able to just go out and get one. So I will be sending that as well for you all. It is the holidays, so they do have some great sales that's going on now. I know Affirm, you can go through Affirm. They have some things, PayPal, different little resources that I'll be providing for you all for those who might need assistance with getting a laptop or a desktop computer. Also, again, I know I've been having students that's been having technical difficulties. This is in several of the classes with uploading and getting into module 156. If you're having difficulty or you're not able to access your assignments in module 156, please send me an email. You will not be held, anything won't be held against you. Just let me know and I will reopen your assignments. I've had 4 students so far to let me know that they're having difficulty with logging into module 156. So if you're still having trouble, please let me know and I can reopen your assignments and labs. You will not be held accountable. You will not get any points taken off or anything. Several students are having difficulty with logging in. So today, we're going to just do a review. Remember, next Tuesday is your first chapter exam. Next Tuesday. So make sure you're becoming familiar with the information that we're reviewing. Let me share my screen. Because majority of what we have covered will be on your exam. So first thing I want to go through before we go to these PowerPoint slides is a little recap of what we already covered. Let me go back. Let me go on here. And then this too will inform me if you all are reading your PowerPoint slides, if you're actually going through the information and reading and not just looking at the questions and putting the answers, but if you're retaining some of this information. Because what's going to happen, like when I do that pre-test, that's for like extra points, but you have to know the information. You do, and you have your resources in front of you. You're able to take your exam, you're online. So you have your book, you have everything you need to be able to get the correct answers. You're not getting the correct answers because you're not reading. And you look at the first little thing, what is a health record? And you see that first little sentence and you're jotting that down, copying and pasting that, and not really reading through what you need to read. I had quite a few people had that first question wrong. What is COP? I think that was the one. Several people had that wrong. So if you had like 55 out of 60, that's because you had it wrong. So just remember to go into the system and make sure that you're understanding what you're reading. I don't know, my it just clicked off of what I had on here. I'm trying to go back. Like I said, everybody's been having technical difficulty with the system. I don't know what's going on. It won't allow anybody to get in. Okay, so we're going to do a quick little review. Let's see if any of you read. So the first thing, who can tell me, and I'll be jotting down points for this, so we can have our little points on here. Okay, who can tell me what is a health record? It shouldn't take that long. I mean, we just went over this, and so what is a health record? Not everybody at one time. Everybody's on mute. I don't hear anything.
It's a complete and comprehensive patient history of basically like all their health history, vital signs.
Correct. So remember, a health record. That was one of your questions for your daily assignment. What is a health record? So this is the information, like I said, this is very important to know because this information will be on your national certification exam. You're going into medical billing and coding. You have to know what is a health record. That's going to be on there. And they're going to have several, like I said, your national certification exam is multiple choice. The entire exam is multiple choice. So you have options, but you have to know the correct information because like I said earlier, for those of you who are not on, my newer students, they might have one word, is and it isn't, or it might be isn't and it is. So you have to know the information and you have to look at everything to rule out what it's not. So we know what a health record is. Okay, we're gonna go through who documents in the health record.
The physician?
Yes, who else? Who's that that's giving me that's you, Ebony?
Yeah, I said that.
Okay. So who else? Not just the physician. We went over this on Tuesday. Who documents in the
patient too, right?
Repeat
the patient too, right?
No, the patient can't document in their record, in the medical record, in their health record. They can't document. They provide the information, but they don't document it.
It's the physician,
authorized clinicians, and the staff.
Not all staff. So which staff?
The administrative staff.
The administrative staff, the authorized staff.
Well, authorized staff, not the administrative staff, because the administrative staff still do not have access to a patient's health record. but authorized staff who have authority can document in that health record. So who are some of the other people you said? The physician, who else?
The doctor.
The doctor, yeah, which is the physician, who else?
The nurse practitioner,
Uh-huh.
the physical or occupational therapist,
Mm-hmm.
the social worker, the specialist, the surgeon, and the medical biller.
Right. Didn't you find that in the book?
Yeah.
Right. See, that's what I'm saying. So all of the information, anything that's requested or anything that's on that exam, it's in the book. You have to read. But then this type of stuff, you're going to have to know. So this was some of your questions already in your daily assignments. So it shouldn't take that long for you all to know the answers. So when you're reading this information, it has to be reading to remember and to be able to answer the questions, not reading just for that day or for that test, because for that national certification exam, the stuff is going to be there for you, but you're going to have stuff that you retain. You have to retain this information. As for coding, you don't have to retain coding information because you're going to have, most of the time, that stuff is going to already be, the codes are already going to be in the system for that whatever specialty area you're working in. But information like this, you have to know it. You have to know it. Jared, what are you laughing at?
My coworkers talking in the background.
Oh, okay. You have to know the information. So it shouldn't be that you all took that long to remember something that we went over on Tuesday. Today is Thursday. And if you're reading your PowerPoint slides, and if you're reading when you're doing your daily assignments in labs, this is stuff that has to be retained. So we already went through that. Who owns the health record?
The patient.
The doctor's office.
The healthcare facility that makes the record.
Correct. The person who actually makes the record, that office. And how is the patient able to get information? And
They
what
have to
can they
request it.
get?
Release form?
Yes.
They can only get a copy.
They can only get a copy from a release form. And so remember, some places, some offices, they can require a fee for them to receive those copies.
Yeah.
Next. So what is the difference between an electronic health record and the electronic medical record?
The health record is basically anybody can access it across multiple healthcare things, where the medical record itself is just basically a paper copy for one healthcare facility.
Exactly. Very good, Anthony. Exactly. So you have to know the difference, because that's always the little trick question that they give you that, like I said, on the certification exam, a lot of people miss that. They always miss that question. So remember, you have to know these key terms. This is on that medical office administration exam. You have to know the key terms. The key terms are also in the appendix in the back of your electronic health record book. There are plenty of key terms. Become familiar with those key terms. So we went over this as well. The electronic health record versus the electronic medical record. We went over the differences between the EHR and the EMR. So remember those abbreviations. Remember, your exam is Tuesday. So familiarize yourself with this information that we have covered. Electronic health record, EHR, electronic medical record, EMR. Know which is which one? is for the EHR, which one is for the EMR. We went over content of the electronic health record, clinical information, what's located and what's in the clinical information. So tell me, what's in clinical information? What documentation is in the clinical information in the medical record?
Things like the co-payment, which is set by the insurance company. Usually the patient's insured, like third party, patient's information, emergency contact.
So yes, for the clinical. And also like what is in the clinical, not the other, what is in the clinical part of the medical record? Think about it, clinical part. So that's the medical part of it. What's in the medical part, the clinical part of that documentation? What is located in that clinical part? It wouldn't be the insurance information, only what's in the clinical part.
Is it the patient information?
Patient information that consists of what?
They what I'm trying to say.
Immunization
They
record.
personal information. They personal information. They
Like is it immunization records? What else?
Diagnoses and treatments that have been
Yes,
provided.
that type of information. The progress notes, would you say like the information progress notes of what's going on, their chief complaint, all of that stuff would be in the clinical documentation. So on here, like if we go down, the health record is the primary source of information about the patient's medical history, such as immunization records, operative reports, and progress notes. This is in the clinical information section. When you get ready to get into the SIM chart, you're going to be documenting that stuff in clinical care. When you look at, you're going to have the front office stuff that you're going to do stuff in. That will be your insurance policies, insurance, what their coverage is, everything. If they have third-party payers, if it's Medicare, Medicaid, who the insurance carrier is, that would be in your front office. For your clinical documentation, it'll be the immunizations, their operative reports, progress notes, and all of that. And then in that last section will be the coding and billing. That's where you will be putting your codes in for whatever they were there for. Next, it has here, medication list. This is what's going to be in that clinical section. Allergy list, immunization records, laboratory reports, pathology reports, surgical reports, hospital records, history and physical assessment findings, risk assessment, preventive services, progress notes, vital signs and growth charts, imaging test results such as radiographs and magnetic resonance imaging, which is MRI. All of this is clinical. So on your exam, I'm letting you know you're going to have to list several of this information that's located in the clinical record. Administrative information. In addition to providing clinical information, the health record enables the administrative staff to perform front office activities. So in that front office, which I showed you a few minutes ago, that would go in this section where it says front office. That information will be located in the front office. That wouldn't go in the clinical section. The front office activities such as maintaining appointments, storing patient contact information, and creating patient correspondence. Administrative tasks also include the necessary coding and billing processes. So it have patient demographics, name of emergency contact person, patient correspondence, referral of consultation letters, all of the super bills and counter forms, day sheets. This would go under the front office portion. So what are some legal documents? What are some legal documents that should be included in that medical record?
the HIPAA form and stuff like that.
HIPAA forms could be included, but what are some other forms as far as the legal?
Medical release
health-
form.
Yeah, your health record release form, consent forms.
Yes, that would be considered, and also some other information that would be in your legal forms.
Advanced directives.
Yes. The complete health record is considered a legal document. So the entire record is a legal document. And they tell you the health record release forms, like you said, consent forms, health insurance portability, like you said, HIPAA, advanced directive disclosure laws. Everything in that medical record is considered a legal document. We went over this last week too, who documents in the health record. That was all right here, which you all went over. That's who documents in the health record. Then on that, see, that would be located in the front office. We went over who owns the health record. We did the critical thinking. The electronic health record transitioning from paper to electronic records. That's always on a national certification exam, always. The Bush administration first declared, and this date, they're going to have this on there. They always just put that on there just because sometimes they give you extra points for it, sometimes they don't. The Bush administration first declared 2004 to 2014. So remember that. Remember, it's always going to end in that 4. You're going to do that 2004 to 2014. That's just like something to put in your brain, like when they have all the different answers, 2012, 2006. You're going to know that 2004, it ends in a 4, to 2014, it ends in a 4. 10-year difference. The decade, see that, of health information technology hit and established the Office of National Coordinator for Health Information Technology. Look at the abbreviation, ONCHIT. The Obama administration continued to endorse and promote the universal use of certified EHR and computerized provider order entry. There it is right there. I don't know how so many people got this wrong. CPOE. Computerized provider order entry. It's in the beginning of the chapter. It's also on your PowerPoint slides. So many students, your classmates, got this wrong. You have to read. Computerized provider order entry, CPOE. Each word has it right here. So I don't know where some people got a hospital from, because they don't even have an H in here. So that means you're not paying attention. You're just breezing by. And like I told you all, I read everything. I read everything. Missy shaking her head. Yes, I read everything. I go through it because I don't want you just putting the wrong answers. And you think that you're getting it right. And then when it comes to that certification exam, you're thinking you're having it right, but it's because you didn't get the right answer. So I just cannot review and go over enough the importance of reading. You have to read. In the Recovery Act of 2009 and the Affordable Care Act, this is when this was implemented. Meaningful use, MU, meaningful use. Then up here, they had the ONCHIT, which was above, has established requirements for EHR certification as part of the American Recovery and Reimbursement Act, ARRA. EHR vendors are evaluated on a set of core and menu objective measures. The Meaningful Use, MU, incentive program is a payment incentive program made available for eligible professionals. EPs are physicians who implement and use their EHR technology in a meaningful way. EHR usage must meet specific requirements. These are organized into 3 stages of care and menu objectives. The main goals of the MU program are to improve quality, safety, and efficiency and reduce health disparities, to engage patients and family, to improve care coordination and population and public health, and to maintain the privacy and security of patient health information. You might want to highlight that. That is on your exam. What is the main goals of the MU program? Here they are. The MUO program is divided into 3 stages. The goal was to allow a slow but meaningful implementation of electronic technology in 2011-2012. They're not going to ask you that information, but it's the 3 stages. Beginning in 2015, all EPs were required to demonstrate 10 objectives and measures. Make sure you know what clinical decision support, that's CDS. Easing the transition 1.1. Make sure you read that section. What is the difference between an electronic health record and electronic medical record? We went over that. Electronic health record software. So depending on what clinic you're in, different people use different software. It says a variety of EHR software systems are on the market. In order for a provider to qualify for MU incentives, what is MU?
Meaningful use.
Correct. Meaningful use. So when we just read over stuff and I throw it back at you, you let me know if you're paying attention. You have to participate. Because if you don't understand, I need to know, and then we can do a one-on-one session. If you need more clarity, we can do that. But these are things that are on, especially in this chapter where we're going to be in, these are things that's going to be on your certification exam. Because they want to know if you're going into medical billing and coding, if you're going to actually know how to chart and what to do in the medical record when you're in the clinic. So along with the billing and coding, this part is very important as well. It says he or she must select software that has been tested by an accredited testing laboratory and certified by an ONC, authorized certification body, ONC ACB, to meet the criteria specified by the Department of Health and Human Services, HHS, Health and Human Services. Although the system still may not be compatible, this standardization of functionality is a necessary first step toward becoming interconnected. Basic functions. Commercial EHR systems have the following fundamental capabilities: progress notes, documentation using free text, predefined clinical templates, or use defined clinical templates, provide a review of incoming laboratory data reports. So that EHR, that system that they put in place, their software has to be able to meet these basic functions. If their software system does not meet these requirements, they will not certify it or authorize it for use. So it has to meet these basic functions along with other capabilities, but these basic functions have to be in the software. Clinical decision support. An advanced feature called clinical decision support, CDS, allows providers to tailor the care of an individual patient by making sure it adheres to published guidelines for the patient's specific diagnosis. Clinical decision support tools allows providers to ensure that the patient's care complies with established screening recommendation for the disease, plan treatment in accordance with evidence-based treatment guidelines, generate patient data, complete documentation. So all of this information has to be able to be processed for clinical decision-making. Then it has here, incentive program funding implementation, at least one CDS element or rule for patients. Under the requirement, the clinical decision support can help providers share best practices regarding the treatment and diagnosis of diseases, reduce the amount of testing ordered, improve clinical outcomes, and reduce the number of misdiagnoses, reduce costs from unnecessary testing, and improve patient safety. So let's do this one here. Critical thinking exercise 1-2. During Dr. Martin's visit with Mr. Hickman, he discovers that the patient has gained 22 pounds since his visit 4 months ago and that his triglycerides are high. Dr. Martin wants to check the recommended adult dosage of the cholesterol-lowering drug he intends to prescribe. Calculate the patient's body mass index based on his height and weight, and give Mr. Hickerson a patient education brochure explaining the link between physical inactivity, being overweight, and type 2 diabetes. Which of these functions can be accomplished using his practice EHR system? How would Dr. Martin go about gathering this information? How might the use of CDS tools help manage Mr. Hickman's diagnosis? So I need you to go back and read or whatever and tell me what your answer is. First question, how would Dr. Martin go about gathering this information? Let's do that one first. How would he go about gathering that information?
Writing down all the information that he's seen Mr. Hickson for.
Right, so first thing, what would he have to do first? Because look what it says, during Dr. Martin's visit with Mr. Hickman, he discovers that his patient has gained 22 pounds. So he's already a patient. Because he's
Yeah.
going,
Right.
what did you say, Raven?
Gather his chart.
Right, correct. And then what? So that's the first thing. How would Dr. Martin go about gathering this information from his medical chart? Getting that information, going through it in the medical chart. How might the use of CDS tools help manage Mr. Hickman's diagnosis? So go back up, if you have your book, and look what the CDS tools mean. And
That
go
way
back up.
he can put together a care plan.
Right. So, but what is he gonna do? Like when he said, how might, oops, sorry. When he says, how might the use of CDS tools help manage Mr. Hickman's diagnosis? So how might the use of the CDS, like, how is that going to help? Hi, Julie.
Hey, sorry I'm late. I got off work a little early.
Okay. How is that going to help? Think about it. How are the tools going to help? Go back and read over those tools that we went over. How is that going to, how are the CDS tools, how can that help manage Mr. Hickman's diagnosis?
And what?
Raven, Jared, Misty, Anthony. Where did you go, Anthony?
Patient has gained 22 pounds since his visit, and that is trials on time. Wants to check record.
Go back through your notes on the top. Like, how might the use of CDS tools help manage Mr. Hickman's diagnosis? Come on, let's think about that. Remember, we went to what everything that has to be in those tools. So how is that going to help with him? How might the use of the CDS tools help manage his diagnosis?
Maybe change his medication or put him on a diet.
So we're talking about now, like, how might the use of the CDS tools help manage Mr. Hickman's diagnosis?
What CDS tools? How might the use of CDS tools? Now I'm just coming in here, but would it? I gotta look up that definition.
So we went over that. So I'm gonna go back up to the CDS tools.
What is CDS component? Okay, components of the advanced tools that patient communication skills on ability to make critical decisions.
So right here, it's telling you, we're gonna go share best practices regarding the treatment and diagnosis of disease, reduce the amount. So all of that has to be in there. But if we go back at the top, the CDS tools work, however, only if providers take advantage of them. So up here, it tells you on what needs to be placed in clinical decision support. An advanced feature called clinical decision support, which is CDS, allows providers to tailor the care of an individual patient by making sure it adheres to published guidelines for the patient's specific diagnosis. Clinical decision support tools, here we go, allows providers, that means all of the providers, to ensure that the patient's care complies with established screening recommendations for the diseases for which he or she is at risk, plan treatment in accordance with evidence-based treatment, generate patient data reports and summaries, complete documentation templates specific to the patient's diagnosis, perform database searches to identify patients who meet specific criteria, such as those with a particular age range. So what is it telling you? These tools, if it's for providers, he can go in and look at all of the documentation, the tests that he's taken, what he had been taking prior to him coming to his office, what has happened previously. And so it asks again, it states, how might the use of CDS tools help manage Mr. Hickman's diagnosis? So it's telling you with all of that information and those tools, what they have, it might give him a better idea with all of the other providers, whoever he's been seeing, as to what actually started on how he will be able now to treat him. What can he do? What does he see in that summary from the CDS that may have caused him to gain the 22 pounds since his last visit in 4 months? What took place? Is it something in the diet? Is it some other medication that he might be taking that might have him gaining weight? Because that happens a lot as well. Steroids or different things that have you to gain weight. So that CDS tool, it says help manage, because all of that information would help him be able to come with a clearer picture of the diagnosis. So does that everyone understand now why that the CDS tools are so important? Because they have all of that extra history. If other doctors or other providers are using it, he can look in and see, maybe he went to a specialty clinic. Maybe he's taking something from somebody else from a specialty clinic that is interfering in having him to gain that weight. So that system is very important because you get to share information across providers. Next, it says, practice management software. The EHR lies at the heart of the modern digital medical office, but most medical practices choose to kick up a notch by using a fully integrated EHR and practice management system, such as that offered in the SCMO. Practice management software, PMS, allows electronic management of the business side of the practice. It allows efficient handling of all front office administrative procedures, including entering patient demographics, tracking billing and insurance information, scheduling appointments, and processing payments for patient visits. Let's take a look at what integrated practice management software has to offer. So all of this is information that you would have to be putting in when they check in, when you're getting that card, that insurance information, all of that goes into the patient demographics. Practice management software compiles all of a patient's demographic information, socioeconomic data such as age, sex, marital status, education, occupation. You know, when you go in the office, you got that big long packet for your first visit you have to fill out. All of that.
Or when the ER lady comes in to get it.
Yes, you have to have all of that. That goes into the system. So that patient demographics, now with technology, they can scan it into the system, but sometimes you have to type all of that information and input all of that information into the system. All of this, so it says within the EHR, it says language, race, and ethnicity within the EHR. When patients present to the provider's office, they are asked to fill out a patient information form that asks them to provide their identifying and contact information, including name, home and work addresses, phone numbers, email addresses, and social security number. Some questions about clinical issues, such as reason for the visit, and administrative matters, such as insurance information, are included on the form as well. The patient demographic tool is the SCMO stores all of the information on 3 tabs: patient, guarantor, and insurance. All of this information has to be input into the system, and that's where it's stored in the SCMO. So in your SIM chart, when you get in that SIM chart, see they have on here, front office, clinical care, all of that information is going to be input into that clinical chart record. Billing and insurance information. It should be determined who is legally responsible, the guarantor for the patient's account, if the patient is over the age of 18. He or she is most likely the guarantor. In the case of minors, it would be the patient's parent or guardian. It is important to obtain the guarantor's name, address, and date of birth. The patient's health insurance cards, if he or she is insured, should be reviewed at each visit. A lot of people have errors when it comes to this, because you don't know. Sometimes that insurance card has expired, or sometimes that insurance card, they're no longer with that company. And just because you have it on file in record, it might have changed. So each visit, you're supposed to review that insurance card. It says each visit and scan into the system. If different from the previous visit, information found on the insurance card includes a type of medical insurance, for example, workers' compensation or Medicare, subscriber's person responsible for paying the premium, insurance carrier, claim submissions, addresses and phone numbers, policy and group numbers, and required co-payment. A co-payment is the amount of money a patient is contracted to pay out of pocket at each visit. So they say show examples of insurance cards. Like here is a Medicare health insurance card. It has, if they have hospital Part A or medical Part B. So remember that hospital is Part A, medical is Part B. They have the information, the patient's name. They have all of the information here: the member, the policy number, the group insurance number, the effective date. They have on here the copay. So that patient's copay, when they go in, every time they go for that visit, they have to pay that copay. Specialist copay is always higher. So, $35. So they have all of this drug copay, all of this is on there. And you're going to take a copy of that and it's going to be scanned into the system. Appointment scheduling. So patients who need to use a healthcare provider are usually asked to make an appointment, a specific time and date reserved to meet with the healthcare professional's physician, physician's assistant, or nurse practitioner. The healthcare professional will examine the patient and consult with him or her about the chief complaint. Depending on office policy, the patient may be scheduled in a variety of ways. The most common method of appointment scheduling is a fixed schedule according to which the patient is asked to appear in the office at a specific date and time. So I have this highlighted because this is important for you all to know. Typical fixed appointments range from 10 to 20 minutes. For acutely ill established patients, to 1 hour for new patient visits. So, you know, a lot of times, and then that has changed. Because now when you go into that office, that doctor's not staying in there with you for no hour, but they're talking about the entire process. So you see right here, typical fixed appointments, your actual appointment range is from 10 to 20 minutes. And this is for acutely ill. You go in that doctor, he'll talk to you a few minutes, you tell him your chief complaint, and then he's out of there and somebody else is coming in. So these are the ranges, because when you get ready to bill, when you're looking for that code and in that medical chart, you have to document, you have to bill for how many minutes he was with that patient. So that's important to know, the typical fixed appointment time range. It says here, 1 hour for a new patient. An established patient is one who has been seen by a member of the healthcare team within the past 3 years. You know, we had this prior. New patient and established patient. It didn't change. An established patient is one who has been seen by a member of the healthcare team within the past 3 years. A new patient is one who has not been seen in the past 3 years by any member of the office. Electronic appointments integrated into the EHR allow quick search of available appointments, easily rescheduling, documentation of cancellations, and quick links to the patient's clinical record. We'll talk more about this in chapter 4, but they're documenting every time you cancel an appointment. They take into account all of that when you're canceling an appointment, which a lot of times gives you delays in when they're trying to schedule with you, because especially the first time cancellation, they don't worry about that. Everything comes up. But if you constantly canceling appointments, remember, all of that is documented in your medical record. So they have on here advanced accounting procedures. Patient accounting is important to the success of the healthcare practice. So we're going to cover this in a later chapter, but you're going to be doing some math when you get into this SIM chart, because you have to know. Let me make this bigger. Waiting for it to pop up. Doesn't want to get bigger. Okay. You're going to have to know the date, the patient name, the provider, the service, the charges. So you're going to have to know that.
Brings back memories.
I didn't hear you, Misty.
I said it brings back memories.
When you had it so long ago, huh? The charges.
Did you do, wait a minute, I'm sorry, Miss Barrett. Missy, did you do registration too?
No, she just graduated. She had this in a class.
Oh,
She
okay.
graduated on Tuesday.
Oh, yay.
So, Julia,
Yay.
that means you didn't
Yes.
read your emails.
I didn't. I just got in here today. I didn't read them today. I didn't. I just come in from work and I seen what time it was and I was trying to get on here.
I sent it out
Yes,
Tuesday.
ma'am.
I sent it out
didn't.
Tuesday, Julia.
Well, I
You
don't
gotta
know.
read your emails. That's what I'm telling you.
I
I
didn't
started
read
out
them.
so you weren't here. You have to read your emails, everybody.
Yeah,
Read your
I
emails.
know. I know. Well, congratulations, Misty. I'm so tickled for you.
Yes.
So,
Thank
I mean, I'm
you.
curious, what are you taking now, if I may ask?
She just graduated Tuesday, so she has to take a certification exam.
Oh, so it's like a refresh.
Yes. So
Okay.
once you graduate, you still can come back on and participate in the Zoom classes.
I gotcha. Okay, well, good.
Yes.
Good to know.
So on here, we have the charges, the payment, you have to know those deductibles, you have to know those co-payments. All of that is going to be put in the system. All of this is going to be put in, and then you have to know how to subtract, add, divide, all of that, because you have to come up with that bill. You're going to be doing all of this in the medical clinic.
And multiply.
And multiply, yes. Yes. So next we have, it says, after the patient's financial information has been documented for the medical office, a claim must be submitted to a third-party payer. If the patient is covered by a health insurance policy, A third-party payer is someone other than the patient, spouse. This is on your exam. So listen, this is on your exam. A third-party payer is someone other than the patient, spouse, parent, or guardian who is responsible for paying all or part of the patient's medical expense. In most cases, the third party is a health insurance company. HIPAA 5010 is a standard electronic format that speeds claims processing for physicians and suppliers. So a third-party payer, remember, is everybody other than the patient, spouse, parent, or guardian who is responsible for paying all or part of the patient's medical expenses. So you're not going to get into this until we get into that last portion, which is going to be the coding and billing. So once you have reviewed and you've gone through that medical chart, you're going to be picking out all of the information that you're able to bill for. That's going to go here when you're going to do that claim form to submit to that third-party payer. And they have advantages of electronic health records. You need to read over that. And then managing patients with chronic conditions. So you need to know, what is the advantages? What are the advantages? Let me go back over here. What are the advantages of a record? And then we'll be stopping there once I finish with this. Remember, on your PowerPoint slides, you have the information when it comes time to that exam on Tuesday. Remember, your exam is on Tuesday. Clinical information. It's on your PowerPoint slides. What's included in the clinical? It's on your PowerPoint slides. Administrative information, PowerPoint slides. Legal documents. What's included in the legal documents? We've covered all of that. Who documents in the health record? Who owns the health record? The electronic health record. We've gone through all of that.
Okay.
Basic EHR fact functions. EHR versus EMR. Basic EMR functions. This is the basic, trying to move this over. The basic EMR functions. This is the information that's in your PowerPoint slides. Clinical decision support. In your PowerPoint slides, so the clinical decision support, because that's on your exam, allows providers to set protocol for specific patients and our concerns based on evidence-based treatment protocols, automated preventive care reminders, treatment plan templates, generates patient data reports, documentation templates. So all of the providers have information that's in this CDS, clinical decision support software system. Practice management software. Administrative software used for patient demographics, billing and insurance information, appointment scheduling. These tasks are now incorporated as part of the EHR. So all of this now, which wasn't before, is in the electronic health record. So right here, we're going to stop here. Advantages of the electronic health record. So the advantages are improved quality and continuity of care, managing patients with chronic conditions, disaster preparedness and response, increased efficiency, improved documentation, easier accessibility at point of care, better security, reduced expenses, improved job satisfaction for providers and staff, improve patient satisfaction. Disadvantages of the EHR: lack of interoperability among some products, initial costs, because you have to realize this is very expensive for all of this storage that they're using, financial investment, implementation time, employee resistance, regimentation, and security gaps. Because sometimes they're saying with security gaps, like sometimes people are able, the system is compromised. So we're going to stop there, but I need you all to read Continue to read your PowerPoint slides. Roles of the healthcare professional, read over there the basic skills needed. You have to know knowledge of medical terminology and anatomy and physiology. Every part of healthcare is important. This is no exception. Basic typing and computer skills. Yes, you have to get comfortable. It takes time, but you can get it. Organizational skills. Prepare yourself to go paperless. As you know now, you can't even do an application in person. Everything is online. Interpersonal skills. Help the patients through the transition too. So these are things, the role of the healthcare professional. The most important in medical billing and coding, because the doctor's handwriting can be so, you cannot read basically anything. You have to know that medical terminology. Halftime, everything is going to be shorthand. They might just put 2 letters and you're supposed to be able to figure it out. So you have to know your medical terminology and your anatomy and physiology. Look in your CPT manuals. They have beautiful diagrams of the anatomy, of the body, everything. Look in your appendix in your electronic health record. They have the glossary. Become familiar with that medical terminology in the back of the glossary. So pay attention, read the gray sections under your PowerPoint slides. Let me stop sharing. Oh, look, wow, I didn't even see I had all of these people on. Great, good. Let me get your names so I can make sure. So I have Anthony, Ebony, Jared, Julia, Tara, Raven. I have 2 Ravens. What Raven is this?
Taylor.
I'm sorry, I couldn't hear you. Raven, Tyler, what'd you say?
Taylor.
Taylor, okay. I have 2 Ravens. Penny, Alice, Samantha. Did I miss anyone? So I have Anthony, Ebony, Jared, Julia, Raven, Tara, Penny, and Alice. Am I missing anyone?
I don't count.
Okay, so any questions or concerns? Remember, this exam is Tuesday. Please remember to complete your daily assignments and your labs. If anyone who was not on, did not complete, or had difficulty with logging into module 156, please email me so I can send a help desk ticket. Please email the help desk yourself and then CC me on it so I can send it to the director. We have been having some difficulty with students being able to log in to module 156. They've been having some technical difficulty. So please let me know if you had technical difficulty logging in, and I will reopen your assignments. You will not be penalized for not completing, and then let me know so I can also update your attendance. So please send me an email informing me that you were having difficulty with logging in. Also, please try and do these daily assignments. This is the beginning of the module, the beginning of module 156. You only basically have 1 question. It only takes 5 minutes, 5 to 10 minutes to answer the questions. Remember, everything that's on those daily assignments is information that we're going over in Zoom class. If you don't get it in Zoom class, read your PowerPoint slides, read the chapters. Any questions or concerns? Any questions about the lesson today? Any questions, or does everyone understand the information that we're covering so far?
Again, yes.
Yes.
And if you're not, please reach out to me so that we can do a one-on-one. If you're not getting it, please do not feel that you're embarrassed or you don't want to, you're not getting it. The only way you can get through this is to communicate. If you're not understanding, because guess what? Like I said, when we get into the actual SIM chart, you're in the office, you're in the medical office, you're going to have partners. So you have to be accountable to your classmates because you have to team up. And these are partner assignments. because you're going to have to learn how to work in an office setting. So if your partner is not contributing, you still have to let me know. Misty, remember, y'all had quite a problem with that at first.
Cool.
Because if your partner doesn't do the assignment, then you get a 0 as well.
No. Oh my gosh.
Tell them about it,
What-
Misty.
What happened?
Goodness, where do I start?
Oh no.
But they got it. When they start getting those zeros, they start working together. It's communication, because you have to realize you're not going to be working alone in the office.
Right.
So you have to be accountable with your co-workers, which is your classmates. You have to be accountable, and you have to work as a team. And I know people have different schedules, but submit your stuff, because the way they were doing it before, like I know with Missing them, they did it whereas somebody would do one part, somebody would do the other, and then they would submit it together like that, because everybody's schedules are different. So they would just put it in their group.
We would
And
all
then-
take like one lab and do it and get it sent off.
Okay.
Mhm.
That
So after
way
they got quite a
could
few
get 'em
zeros,
all
they
done.
understood. So yes, but it was fun. Like they say, it was fun, but
I was scared at first.
but you have to be accountable, like I said, because you're going to be working in a clinic. You're not going to be working by yourself. So you have to be able to work with others. You have to be able to communicate. And like I said, everybody have different schedules. So it's just that communication piece. We had students who were sending their information, like sent one question in, but they had a lead person for each group on who they would send those assignments to. And then that person would send it as a whole. So it's however you want to work it when you get in your group. Who wants to do what, if you want to send it, but it's group assignments, it's partner assignments. Any questions or concerns? So that's why you have to read this information, because I'm not going to be grading it. The system is going to be grading it in the SIM chart, because you're in a clinic. I cannot see anything until the assignments are complete. So say one person didn't complete their part in the SIM chart, nobody gets a grade.
Oh my goodness.
So this is the part where I'm saying that's why you have to have a computer, because everything is going to be in the clinic. Any questions
My
or
laptop
concerns?
on.
Any questions or concerns? Remember, I'm going to send out some resources for those if you might not have a computer. If you need to get one, they have different resources. I'll go get with the director that she shared prior, and able to assist if you're having difficulty with getting a computer. Remember also the M. Foster grant. Remember, if you need assistance with getting that grant, they have funds still available for you to reach out to your registrar, the person who signed you up. Reach out to them about the M. Foster grant. They have still
I
have
got
funds
it,
available.
y'all. Yeah,
Oh, you
I
got
got it. I got
Okay.
it. I did. I was proud.
Good. So please reach
I got
out.
mine too. Like, I remember Jared came on and he was talking about it, so I went and reached out to who I needed to reach out to.
Your financial aid
And
officer.
they approved me for it. So all I have left to pay on is like a very little bit. Which
Right. So
not
go through your financial aid officer, apply for that grant. Don't be ashamed, afraid to apply. The only thing they can say is yes or no. So please apply, contact your financial aid officer. They're going to send you a form, complete it, and it comes back fast. I know Misty said it would took like 3 days, and she was
If
approved.
that, I think I got
3 or 4
approved, yeah,
days.
in a couple
Yes.
of 2 or 3 days. It was really quick.
Yes. So please.
I
contact
ended
your
up,
financial aid
it's
officer.
worth it because I ended up with a full ride.
Mm-hmm.
I was
Good. See
excited.
that? Yes.
Yeah.
So
Well, see, this
contact your
is my
financial
second
aid
go
officer.
round.
Huh?
I said, so
This is my
contact your
second-
financial aid officer. I'm sorry, Missy, I didn't hear you.
I was letting her know this is my second go around going through this program.
Oh, okay. I didn't know, Missy. Okay.
Yes, and she graduated with an A average. Go ahead, Misty.
Good. Get it, Misty. Get it. Yay.
Yes, so you all enjoy your evening. Remember, your exam is on Tuesday. So I will be sending you all out a pre-test, which is gonna be an extra 100 points. So please, I mean, if you don't want to take it, you do not have to. You will not be penalized for it. But this pre-test will be an additional 100 points if you take it. I'll be sending it out tomorrow. You have until Sunday to
Excuse me?
complete that as well. Yes, Tyra?
Did you ever assign the partners, or did I miss that part?
Assign, I'm sorry. No, I didn't do the partners yet. No,
Okay, okay,
no, I haven't done that. That won't be till a couple of weeks.
I do
okay.
have
I thought you said you was gonna do it Thursday.
We're
to
not
make
gonna
sure
do
we
it.
was
The
on the call.
instructor, yeah, we got the instructor said that they're not gonna do it right now. That
Okay.
Everybody wants to start it at the same time with going into the actual sim chart.
Okay,
Because
no
it's
problem.
complicated. It's complicated.
Gotcha.
Yes.
I do have a question, Miss Berry.
Yes.
Which one am I supposed to have the tabs for? Which book? The ICD or the CPT?
Both of them.
CPT already
where-
has books.
See, I didn't, I had to go. I never did get the books.
You
Never
went to
did get
the,
them.
you
But
went
I
to the,
went, well,
school.
I mean, yeah, I went to the school and picked them up, but there's no tabs. Like, where would they be?
You have to tab your own book. Your CPT, the tabs are in the front of the book.
I see it now, my bad.
The
I see it now.
ICD-10, yeah, the ICD-10, you have to buy your tabs. You can get them at Dollar Tree.
Oh,
you can use-
okay.
Or you can use sticky notes, whatever is comfortable, whatever is best for you until you're
Okay.
able to get
That's
your
the
tabs.
one I was looking for. Okay, well, that makes sense. Okay. Thank
Yes,
you.
yes.
They
Any other
sell
questions?
them on Amazon.
I didn't hear you, Jerry.
They sell them on
They sell
Amazon.
on Amazon.
Oh, Jared, how much were they? I'll check them out then. Okay. Thanks, Jared.
And like I said, if you're not able to do that, stickies, look, sticky notes.
I
work
got a
as
bunch
well.
of them.
Yeah,
I got
so
a
you're
bunch.
able to get them. You have to,
Yeah.
you have to compromise. You have to use, use
That's
sticky
right.
notes.
You got to.
Yes, yes. Any other questions or concerns?
Can we throw a party for me?
Yeah. Girl, I got a
Yes.
sun-kissed orange right here, just in your honor. We drinking for
All
you.
right, everybody. Look, stay safe. Study, read. I mean, it's not so much studying because when you take the exam, you have your book in front of you. So, I mean, it's not so much studying. Read. Remember the day reading is the key to success? You have to read. Knowledge is power. And for those who are not reading those emails, I'm not calling you out, Tyra, because you're reading them now. You're reading them now.
I read them now faithfully.
Yes, I sent those a positive affirmation. Read that. Success, everybody goes through some things, but you have to keep going to get to that end. And like I said, this is a very profitable career. So please take it serious and do what you need to do. Read. If you have questions, please reach out to me. I will respond. You all enjoy the rest of your evening. Stay safe. Exam Tuesday. And I'll be sending out that pre-test for those who want those extra 100 points.
All
Bye-bye.
right. Bye-bye.
Good night.
Good night.
Good night.